Hey folks, it is Easter Sunday and I am in my jammies hanging out because it is ugly out there. Happy Easter from Omari as well. We're here today hanging out and I figured since I'm just hanging out in the house, why not sit down and talk to y'all? Oh, FYI, power's out. So, what do I want to talk to you guys about today? Today I want to talk to you guys about implants. Now, a lot of times we have the interest in having breast procedures done. I know I, for myself, am somebody who has had breast procedures done. I've had a breast procedure done. I had implants put in several years ago. Now, I have found that ever since I put my implants in, my breasts have become much heavier, which has caused the placement of my implants to be a little bit lower due to gravity, due to weight, due to a bunch of different factors. Like, I never would like to wear a bra, like now. So that definitely has an impact, right? But I want to talk to you guys because I've been involved in some groups recently on Facebook, and I've been coming across a lot of the same topic trending in these groups. And it's, hi, I am in my mid-40s. I'm interested in a breast reduction and a lift and implants. And, you know, the comments from the peanut gallery are going crazy. Why? Why would you need a reduction and a lift and implants? So I think it's a perfect time to talk about it. I think it's a perfect time for you guys to have the right information and understand that there are different procedures and that different breast procedures are needed for different types of things, and I think we should talk about it. I don't think there's enough conversation around who can get implants versus who needs a breast lift with implants, why you would want a breast lift versus just getting implants alone. There's also things like, again, why would you need an implant in general if you have already naturally large breasts? So let's start with the idea that you've got large breasts and that you're interested in having a reduction, right? If you have large breasts and you're interested in getting your breasts reduced, that is one type of procedure or one type of modification that you're looking for. So a reduction talks about the size of the overall breast. It doesn't necessarily talk about the placement of the breast. It doesn't talk about the roundness, the fullness, the polar shaping. It doesn't talk about any of that. All it says is that you want smaller boobies, right? So that's the first thing. That gives a surgeon an idea of when they're doing this lift, how much they can take out, how much they can reduce your size. Because anytime you get a lift, you're going to lose size. You're going to lose some of your volume just because some of the excess tissue and excess skin is going to be removed in order to give you that lift. So it's going to result in a smaller breast size or smaller cup size 99% of the time. But again, so now you've got big breasts, right? You've got larger breasts and you're looking to have a reduction. So you tell your surgeon, I would like to have a reduction. Now, more than likely, if your breasts are large and you're looking to have a reduction, they're probably not the perkiest breasts in the world. Mine are a double D, and if you look, my breasts should be up here. They're not, they're down here. Why? Because it's been 4 or 5 years since I've had my implants put in. I didn't have a lift. They weren't placed under my muscle. And so with time, of course, right, your boobs start to drop as your natural breasts do. So again, if your breasts are on the larger side and you're requesting a reduction, you're going to have a lift done automatically. Why? Because your breasts, like I said, are probably not the perkiest. Your nipple location, your areola location is probably not as high or as centered as you'd like it to be. So by having this breast lift done, you're going to now not only lower the size for the reduction, but you're also going to relocate, reposition your entire breast tissue and the supportive muscles that are holding your breast together. Right? And so within a breast lift, you're going to reposition your areolas. You're going to reposition the whole shaping and the whole volume of your breast. So, right? So now you've got a reduction and you've got a lift going on. Now, depending on how much sag or how much laxity you have in your current breasts will also impact, and your breast tissue itself will also contribute to whether or not you really will benefit from a implant. Now, why do women get implants if they have big breasts and they're requesting a reduction? Why would you entertain an implant? What would be the reason why a woman with big breasts who wants them smaller would get one? The idea is with time, our homegirl gravity is always around and always kicking in and always creating a little bit of havoc, right? Because she likes to make her presence known. And so what happens? Our breasts begin to sag again. And so with time, or even with recovery time alone, your breasts are going to drop, right? After your first few weeks when you have your breasts done, they're going to sit very high, but slowly they're going to start to drop. And as your breasts begin to drop and enter a natural position where they're going to be sitting, and your post-op bras should be supporting you and creating a good support for you in that area, you've got to understand that you're going to lose this shaping that you get up here that implant will provide. Many times women think, well, I want my breasts to be smaller, I don't want an implant. Well, that's fine. You don't need to have an implant, and you can opt not to, but you need to understand that it's very likely that you're going to have a much more natural look and not a look that's defined or giving you the polar fullness up top. So you want to just kind of keep that in mind. Now, this works the same way for those of us that have smaller breasts or that are starting with smaller breasts, right? If you have smaller breasts, what happens? Do you need an implant automatically? Does that mean you don't need a lift because your breasts are small? No. What happens is many times after those of us have had children, or we've gone through weight loss or any of those types of body activities, what happens is that our breast tissue stretches, a lot of it loses its elasticity. And so what happens is that these tissues are not supportive anymore. And so in order to go ahead and give you the right type of look without having you sag again, or without having your implant shift or move or not have the right support to hold it in place, you get a lift. Now, if you have no breast tissue, and what I mean by no breast tissue is if you can touch yourself and you can feel that you don't have like much fat under your skin, if you feel like you don't have very good breast tissue, or if your surgeon tells you you don't have much breast tissue, that may just be because 1, you don't have a high fat content in your body. 2 could be you've lost a lot of weight. 3 could just be that, you're a thin person naturally. You don't have very thick breast tissue. Whatever the reason is, right? Then, of course, you're still going to end up with a lift, but the placement of the implant may be different. The reason I say that is because when the implant is not placed specifically under the muscle and you have no breast tissue, as your breasts stretch, you have the unfortunate circumstance where you run into starting to feel ripples in the center of your breast, where you can locate that your implant is shifting. You're able to feel your actual bag and your implant much easier and right through the surface of your skin, whereas if you had placed it under the muscle, that wouldn't happen. Now, the fact that these implants will be placed above the muscle as opposed to under the muscle, if you have very little breast tissue, will also contribute to your breasts sagging faster, because again, they don't have the appropriate support. If you don't have good breast tissue and you don't and your breasts are already a little bit lax and the tissues have been through it, or you've breastfed, or you've been much heavier and you've lost weight and your breasts have kind of come down with you, these are things that you want to think about. So just wanting to keep you guys posted that an implant is always suggested when getting a lift, but the reason for it is more because of an aesthetic result. Not many women are able to achieve that same polar fullness as other women that don't have the same amount of breast tissue. So again, reductions are there when you want to reduce, but that just indicates to the surgeon what you're doing with reference to size. That never has an implication on a lift or not a lift, but you will always get a lift if your breasts were on the bigger side and you're now looking to make them smaller. Just putting that out there. Second, a lift. A lift is there when your breasts have already had stretching, when your breasts have already taken a beating, when your breasts have lost a little elasticity, when your breast tissue is not as tight as it should be. That is when a lift comes into play. A lift is not typically offered to young girls or girls who have not breastfed yet or have not had these drastic changes to their body. Also, women that have very small breasts or don't have much breast at all typically are not offered a lift because they don't have any stretching of their tissue. This is why you may see that some girls like that go straight for the implant. However, if you've already had some type of a larger breast, a breast that has some type of hanging capacity, some type of gripping, lifting capacity like this, then you're definitely in need of a lift. And the only reason you'd want to consider an implant is for shaping. So I hope that gives you guys a little bit of information and answers some of your questions when it comes to breast procedures, breast lift, breast reduction, implants, yes or no, should we not. We'll do a whole nother conversation about implants at some point and talking about the different types of implants. At this point, my personal suggestion for you is to only use high profile gel implants at this point. Silicone gel, but gel implants. These are the implants that are the top of the line right now. You do not have to switch them out anymore after 10 years. You do need to be mindful of your breasts. You cannot put them in and never look at them and never check them out. But you definitely don't have to worry that, oh my God, if I get them put in 10 years, I'm going to be 50, I'm going to be 60, I'm going to have them removed or changed, and I don't want to do that. You don't have to worry about that anymore. Technology is advancing every day, and so we're always looking for better solutions for you to make your goals sustainable and help you along the way. So if you guys need anything, let me know. You guys know to follow us on Instagram at Sirena Surgical Services. Make sure you guys stop and follow our new page, She Saw Me RD, so that you guys can stay in touch with all of our new shapewear line products that are going to be coming out and all the new releases that we have happening. And as always, stay up on our recovery house and the informational videos. Comment here, like here, subscribe here, share this link in your video sections of your groups across the board. Help girls get the help that they need, because you guys know how freaking scarce the good resources are. Now, again, as always, if you need anything, you guys know how to find me. Meanwhile, I'm gonna go. Talk to you later.